Representative Lori, members of the committee, thank you very much for the opportunity to be here today. I am Dave Fiedbeiner, the Senior Vice President for Advocacy at the MHA. Mr. Russell, the CEO of Three Rivers Health, is here today presenting some information about the impact of the proposed budget on Three Rivers Health, but also presenting today testimony on behalf of the Michigan Health and Hospital Association. We're happy to have him here, and we'll let him get started.
Thank you, Mr. Chairman and members of the committee, and good morning. My name is William Russell. I'm the Chief Executive Officer, Three Rivers Health. Three Rivers Area Hospital Authority is an authority-owned, quasi-governmental, non-profit regional medical center and healthcare organization located in Three Rivers, Michigan. Three Rivers Health is controlled by the Three Rivers Health Authority Board. The medical center is governed by a 12-member voluntary authority board. The board members, whose only remuneration is knowing that they have represented the interests and wishes of the medical center's governmental units and broad constituencies, are dedicated to providing the best possible care at the lowest cost to customers. The authority also owns and operates 4 rural health clinics. We employ 13 community-based physicians, 8 mid-level providers, and 320 full-time equivalents. I am here today on behalf of the Michigan Health and Hospital Association, which represents all 144 community hospitals throughout the state. I want to thank you for the opportunity to testify today on Governor Rick Snyder's executive budget recommendations for funding Michigan Medicaid program and the claims assessments needed to replace the current Medicaid HMO use tax. The mission of Michigan hospitals is to care for all those who pass through our doors regardless of their ability to pay. That mission is seriously threatened, as are the healthcare services for the patients who seek treatment in Michigan hospitals millions of times each year. You may know that nearly 1 in 5 Michigan citizens relies on Medicaid to cover their health care needs. You should also be aware that the number of Michigan citizens without health insurance is of any kind increased to 1.35 million. And taken together, this means over 3 million people in Michigan are either enrolled in Medicaid or are not insured. At Three Rivers Health, self-pay payments have increased by over $350,000 a month over the past 2 years. In my particular industry, self-pay is a euphemism for bad debt. Over the course of 120 to 150 days, that $350,000 a month will progress to bad debt and or charity care, both rapidly on the rise. The hospital community is grateful that Governor Snyder recognizes the need to avoid further cuts to Medicaid provider payments. Michigan's hospital leaders agree with the government that in an effort to improve the health of the state's finance and its residents, Michigan hospitals are mission critical. The health care safety net provided to Michigan's communities is frayed to the point of disintegration. Patients and providers cannot afford any further stress related to inadequate funding. I believe the governor also recognizes that our state must make smart financial decisions. In the coming fiscal year, 2012, Michigan will receive almost $2 federal dollars for each state dollars we spend in the Medicaid program. This is an excellent and immediate return on investment of state funds. I would like to reiterate that I'm referring to state funds. Because Michigan's general fund has been inadequate to support our Medicaid program, Michigan's hospitals, nursing homes, and HMOs tax themselves to put up the state money that generates this federal match. I believe you heard testimony earlier that general funds support less than 14% of the Medicaid budget. This is because the vast majority of state matching funds come from the major healthcare providers, the same organizations that provide critically needed services to our most vulnerable citizens. I must be clear that the executive budget does not include sizable cuts to Medicaid. First, for the third year, Michigan hospitals will provide the funds necessary to avoid an 8% cut to provider rates that was first imposed in fiscal year 2009. The executive budget continues this 8% cut. The executive budget also cuts graduate medical education by $67 million, a 40% cut. This generates a savings of $23 million to the general fund. The name Graduate Medical Education, or GME, may sound like a fund for paying tuition for medical school. In fact, these dollars support the hiring of physician residents who are licensed physicians who have completed their medical school. These physicians provide care in hospitals and clinics, homeless centers, and laboratories, and provide a large proportion of the care to Medicaid recipients. Physician residency is critical to the 48 teaching hospitals across the state, but is also critical to hospitals like Three Rivers Health. Physicians who do their residency in Michigan are more likely to remain in Michigan. Attracting and retaining physicians in the next 10 years will be an escalating challenge as the country faces a growing physician shortage. By bringing physicians to Michigan for their final years of training, we will not only improve our healthcare system, we will also create high-skill, high-wage jobs. My colleague, Dr. Mark Hennis, also here today, will speak more extensively on physician residency. The MHA endorses his comments as well. There are other needs in the Medicaid budget. As the MHA testified last year, the fate of smaller rural hospitals is in jeopardy from underpayment of Medicaid services. Smaller hospitals have relatively higher fixed costs. Because of this special circumstance, the MHA has an official position that the state must move to cost-based reimbursement for outpatient services provided in hospitals with fewer than 50 beds. This means paying those hospitals what it costs to deliver outpatient services. Many small hospitals receive payment rates of 50% of cost or lower. We also know that labor and delivery services are at risk. In the last 18 months, 3 hospitals have discontinued services for delivering babies. Medicaid is the payer for more than half of the births in Michigan. Medicaid pays less than it costs to staff and operate labor and delivery services. In Three Rivers, 70% of our labor and delivery services are to Medicaid patients. The delivery cost in my hospital is roughly $5,000, and Medicaid pays us just under $3,000 for mother and child. We lose $2,000 on every Medicaid delivery we provide. As you can see, it is difficult for us to make it up on volume. When you lose significant dollars on every delivery, it is only a matter of time before that service must be eliminated. The threat of these services is not simply a function of medical liability, or in our area, it has little to do with undocumented residents of the state. Medicaid is a majority payer for Medicaid or for labor and delivery. The hospital cannot continue to lose more than half of its deliveries and stay in business. Please note that when a service is eliminated, it is closed to everyone, not just Medicaid services. In our community, our board has continued to make a mission-based decision to retain Medicaid labor and delivery services, but we're not sure to date how long we can sustain that. Governor Snyder has set infant mortality as a benchmark on the state's new dashboard. We agree that everyone in healthcare must address this critical matter. To accomplish this goal, increased reimbursement for both physicians and hospital services for prenatal care and labor and delivery must be part of the solution. A legitimate question is asked, where is the funding for small hospital outpatient and obstetric services. The MHA is reviewing the executive recommendation for additional opportunity and is already working with the Department of Community Health and Medicaid, the Medicaid HMOs, and our physician partners to recognize the funding, to reorganize the funding proposals to allow for this investment. However, we are not simply working to find more money. The MHA and its hospital members are committed to creating reforms within Medicaid that reduce the cost of the program. Together, the department and hospitals are working to reduce frequency of claims among high-cost patients, looking at geographic patterns of utilization and frequent emergency room visits. Small pockets of patients can be extremely costly, yet fare no better in terms of health and wellness. The MHA is also seeking to work with the department on its proposals to pilot new efforts related to senior citizens who are eligible for both Medicare and Medicaid. The cost of caring for duly eligible patients is 6 times greater than for a younger adult enrolled in Medicaid. We need to do better by our seniors. Hospitals will play a vital role in improving their care. Finally, we are in very early conversations with the department about how to make certain that we are doing the best practice protocols for perinatal care. Some of the ideas proposed by the MHA may not be scored as savings in fiscal year 2012 budget, but it does not weaken the intention to find ways to improve care for the nearly 2 million people reliant on Medicaid for their health care coverage. The MHA and its members are acutely aware that the executive budget depends upon replacing the existing Medicaid HMO use tax with an assessment on paid health care claims. We are similarly aware that even exchanging one tax for another is difficult to do in this economy and political environment. Despite these challenges, the MHA is committed to working for the adoption of the health claims assessment, the Medicaid program, which is to say Medicaid patients and providers cannot absorb a $1.2 billion cut in the program that would be necessary if the tax was not replaced. A Michigan that fails to deliver access to affordable, high-quality health care is a Michigan that cannot recover, compete, or prosper economically. Each and every patient that walks through the doors of a Michigan hospital is someone's mother, father, son, or daughter. Michigan hospitals need to be there for our patients when they need our care. The first step in ensuring that our Michigan hospitals will be there when you need us is to keep healthcare dollars in healthcare and protecting the system that we have in place. On behalf of the Michigan hospitals, I ask you to support Governor Snyder's executive budget recommendations and to include the restoration of funds for physician residencies through the GMP program, a small and rural hospital for small and rural hospitals, and for perinatal and new baby care. I also ask that you join the MHA and its members in endorsing new approaches to care delivery with the intent of saving money and improving care for patients who are among the state's most vulnerable. Thank you.